Well, welcome to today's webinar, From Assessment to Action. We're implementing the WBTi to strengthen national breastfeeding policies, sponsored by WHO and UNICEF through the Global Breastfeeding Collective. I am Altrina Mukuria Ash, and I'm delighted to be your moderator today. The World Breastfeeding Trends Initiative is an innovative tool designed to measure and track national progress with breastfeeding targets as set forth by the WHO UNICEF Global Strategy for Infant and Young Child Feeding. The WBTi serves as a powerful catalyst for improving breastfeeding rates through a systematic assessment of national policies and policy recommendations. Our goal of this webinar is to increase the number of countries doing WBTi and help them develop action plans based on identified gaps. Together, let's make breastfeeding policy measurable, actionable, and effective. Today, we have an exciting lineup of speakers, panelists who will take us deeper into the topic and share their experience with WBTi. Thank you all for joining us today for this important topic. Before we start, I would like to remind everyone of the housekeeping and Zoom etiquette. This webinar offers interpretation in Arabic, Chinese, French, English, and Russian. To switch languages, click on the interpretation knob at the bottom of your screen. Even those joining in English, there's an English channel that you can use to hear the translations. If at any point during today's webinar you are unable to hear the speakers, please make sure you've connected your audio by selecting the headphones icon. Closed caption in English has been enabled for this meeting. To view the live English subtitles on your screen, click on the CC icon and select to show subtitles. Questions. Please also note that this webinar is being recorded. Please submit your questions for the panelists in the Q&A box and direct your question to a particular panelist. Panelists may reply to your question via text in the Q&A box, or will answer your question during the live Q&A discussion portion of the webinar. Please note that the chat will be not available for this webinar. So use the Q&A to ask your questions. All right, today's agenda. Oops. We'll have, which you've had some of the welcoming and opening remarks. We're going to have a presentation on how monitoring makes breastfeeding matter. We'll hear about the Global Breastfeeding Collective Scorecard 2025. We'll learn about the WBTi processes and methodology. And then we have a great panel of country-level experiences that will be sharing with us. We'll have the Q&A, and then there'll be closing remarks. So let me introduce our first two speakers. We have Dr. Lawrence Grommerstrand, who will be talking to us about how monitoring makes breastfeeding matter. Dr. Lawrence Grommerstrand is the unit head of the Food and Nutrition Actions in Health Systems unit at the World Health Organization. He coordinates WHO's work on infant and young child nutrition, prevention and treatment of acute malnutrition, and prevention of micronutrient deficiencies. Until December of 2014, he served as the chief of the nutrition branch at the U.S. Centers for Disease Control and Prevention. He's earned a PhD from Princeton University and has worked at CDC for over 20 years. He's recognized internationally for his work on vitamin and mineral deficiencies, breastfeeding policy, development of both CDC and WHO growth charts, and he leads the Baby Friendly Hospital Initiative, the Code of Marketing Breast Milk Substitutes, and the Global Breastfeeding Collective. Our second speaker will be Ms. Fatmata Fatima Sese. She will take us through the Global Breastfeeding Scorecard. Fatmata Fatima Sese is a nutrition specialist, infant feeding, child nutrition and development with UNICEF headquarters in New York. She manages the infant feeding portfolio and contributes to UNICEF's global leadership in early childhood nutrition. She has almost 20 years of experience in maternal, infant, and young child and micronutrient nutrition in both development and humanitarian settings. Fatmata holds a MSc in public health from the London School of Hygiene and Tropical Medicine and a bachelor's and master's in nutrition and dietetics from Jala University in Sierra Leone. Welcome, Dr. Grommerstrand and Ms. Sese.
Thank you, Altrina. And welcome, everyone, whether you're joining us in the morning in the United States, in the Americas, or it's the middle of the day for you or the evening. Just want to wish a good day to all. We're going to talk a little bit about why we're really focusing today on monitoring. If you can go ahead and go to the next slide. Thank you. So the title of this webinar is From Assessment to Action. And so I think it's important that we really think about, well, what is the action that we're looking for? What is the end point that this is all for? The Global Breastfeeding Collective, under the leadership of UNICEF and WHO, has laid out 7 key policy priorities of where we really need to move the world forward. We need better funding, better investment in breastfeeding. We need to address the marketing of breast milk substitutes, a key barrier in many countries. We need to look at workplace policies and leave for women, but protection there. We need to look at what we do in our healthcare facilities, particularly in maternity facilities, as well as in the provision of skilled breastfeeding counseling. And we need to do a better job in our communities of supporting breastfeeding. But our focus today is on the 7th of these policies, and it really is around how do we actually support all of the other 6 with appropriate assessment, appropriate monitoring of what are we actually doing on these policies and programs? How are we actually moving forward on funding? And we do this because we know it's important. What gets measured gets done. If we're actually going to make a difference in these multiple areas, we have to assess how we're doing. And countries need to actually be checking themselves over time, how they're moving forward. Next slide, please. At a global level, we actually do a fairly decent job of tracking what's going on in these spaces. We have the Global Breastfeeding Scorecard, which Fatmata is going to tell us more details about in a few moments here, as a way on an annual basis to check how are we moving on each of these policy asks. We have a number of reports that are put out on a periodic basis of what does the world look like in terms of its maternity leave and its workplace accommodations. We have annual reports on, or biannual reports on the marketing of breast milk substitutes and what countries are doing in terms of their legislation there. We have a number of indicators that are built into a variety of systems, such as the NutriDash surveys that UNICEF does, the demographic and health surveys, multiple indicator cluster surveys, and special surveys that we do with countries to really understand what we're doing in terms of the provision of our support services. We know what's going on in terms of how many hospitals have been designated as baby friendly. We have information about the observation within those hospitals of what's actually going on in terms of providing that support in the first days of life. We have information on how many women are being counseled on infant and young child feeding. And we know what's going on in terms of the national curricula in many countries as well, in terms of training our healthcare providers. We also have data on donor funding for this, where we're actually putting our money from a global perspective. And we keep track of our rates in terms of early initiation, exclusive breastfeeding, continued breastfeeding. So compared to many other areas in public health, we're actually doing a fairly good job understanding at a global level of how are we moving forward. Next slide, please. But that doesn't mean that we don't have key gaps that we have to address. Much of the data that we have, particularly on outcomes of breastfeeding, but also on many of these policies, are quite sparse in high-income countries. We do a better job with our systems in low-income countries because there's a greater investment there and coordination. We actually have no information on what's going on in terms of domestic investments on breastfeeding. We know what donors are providing to this, but we have no information about what countries themselves are investing through their healthcare systems, through their general support in the community, through what they're doing for maternity protection, et cetera, in terms of those investments that are being made. The data are available on national policies at a high level of what the policy says, what legislation exists, what regulations are in place. But we have very little information on how those policies are implemented. Are they being monitored? Are they actually being followed? What's the actual action on the ground with regard to those policies? We're often quite limited. And we don't do very much in terms of an overall situation assessment. How are countries doing moving this full agenda forward? And that's actually what we're going to focus a lot today on, is how to do a better situation analysis on a periodic basis so that we actually can target our programs better. Finally, just to mention that the breastfeeding behaviors, we do have key indicators and we measure these well, but they're not necessarily very timely data. And we don't have disaggregations at local level. They give us a decent picture of what's going on at the national level for countries that are collecting the data, but we can't break it down and really get into assessing how our program's doing in terms of truly making a difference in these breastfeeding rates. Next slide, please. When we get to the national level, there are a number of gaps of really how to really understand what these programs are doing. There are a variety of tools that we've made available from UNICEF and WHO. There's a toolkit that's been put out for assessing violations for the code, for example, how to study what's going on in marketing activities. We have a monitoring manual on how to assess the Baby Friendly Hospital Initiative, both at the national level and at the local clinic level, as well as the assessments that might be done for facilities. We have a framework for how to really get at an understanding of infant and young child feeding counseling. When we say we want to cover it, well, what do we mean by coverage? That means when do we actually provide that counseling? What kind of content are we providing within that counseling? Where is it being done? What providers are providing that? And so we have that kind of guidance out for what is needed to understand this better. And we have an indicators manual telling us how we should actually be measuring not only breastfeeding, but also complementary feeding as ways to get comparable indicators across countries. Next slide, please. But in spite of this guidance, we still know that countries need more assistance in how to actually do this monitoring. There are a variety of tools available to them in the Netcode toolkit, in the indicators manual, the Baby Friendly Initiative, using some of the documents that we have on the slide previous. Next slide, please. But ultimately, what we need to see is that countries are checking themselves. They're using the data, they're drawing upon the various resources to collect the information that's going on, and they do periodic assessments of how are we actually doing. Today, we're going to be focusing in on the World Breastfeeding Trends Initiative. This is an initiative that is really based on the WHO Global Strategy for Infant and Young Child Feeding that laid out what should every country, what should the world be doing in order to support optimal infant and young child feeding. It's a process of self-evaluation. It's how countries can look at their own materials in terms of 10 different areas within that strategy on how are they doing in supporting breastfeeding. It identifies various strengths of their programs as well as their weaknesses about their current status on how they're protecting, promoting, and supporting breastfeeding. And it finally establishes the priorities for what they should be doing to improve their environment. These are not externally imposed upon them. This is the priority that you ought to have within your country, but it allows the country to come together through that assessment process to really set its own priorities. Where does it think it can move forward on policies to address the gaps that they found through their assessments? How are the programs not performing as they ought to, and what can be done about that to really set that action plan going forward? So that's really the deep dive that we're going to be doing today. Next slide, please. I want to thank you for your attention. And then I want to move this on to Fatmata, who's going to tell us more about the Global Breastfeeding Scorecard that I mentioned at the beginning as a way to really assess what are countries doing on the various components of protecting, promoting, and supporting breastfeeding. Over to you, Fatmata.
Thank you, Larry, and hello, everyone. My task here today is to present the results of the 2024 Global Breastfeeding Scorecard. As some of you may know, the scorecard is closely connected to the topic we are talking about here today, which is really about monitoring from implementation to action. So basically, the scorecard are issued annually and track changes in the implementation of policies and programs, as well as actions that promote, protect, and support breastfeeding. So I am going to talk about, build on what Larry had just mentioned about the 7 policy actions that UNICEF, WHO, co-leading the Global Breastfeeding Collective, has identified as 7 policy actions that really tracks progress in the implementation of programs, policies, as well as funding to support breastfeeding. This range from funding breastfeeding programs, regulating the marketing of breast milk substitutes, providing maternity protection, as well as support for the baby-friendly hospital initiative, offering breastfeeding counseling, and making community support available, as well as monitoring all of this, which is so important in the conversation we are having here today. So the Global Breastfeeding Scorecard really checks how countries are doing in all of these areas to encourage progress, as well as maintain accountability in promoting and supporting, as well as protecting breastfeeding. So as we can see here, as mentioned earlier, the scorecard really aims to advocate for progress, to increase accountability, document changes in key priority areas. Next, please. So just to give a little bit of background, the scorecard was published, we started publishing the scorecard in 2017, and the scorecard basically includes indicators on the collective policy priorities that I've already highlighted in my previous slide. And of the 7 policy priorities, we look at least 1 to 2 indicator each of the 7 policy priorities. And recently, we also added an indicator on infant and young child feeding in emergencies, which is really crucial to monitor given the scale of emergencies around the world. Then we also monitor breastfeeding rates, as you will see later on in the slides that I will speak about. And then we also basically set targets and features an online dashboard which you can interact with to really see how your country is performing, ranging from green, yellow, orange to red. And then for all of this, we are able to capture indicators performance for at least 194 countries across the world. Next slide, please. So I'm just going to go briefly to the policy and program indicators that we collect that are related to the 7 policy asks that I have spoken about earlier on. Like I said, we ensure that we collect at least 1 to 2 indicators which are assigned to each policy ask. And in this slide, we basically summarize the program indicator and the data sources, as well as the policy indicators from various other sources. We basically set the targets to increase the number of countries meeting the level of performance by 2030, with the collective establishing realistic targets over a 13-year period. For example, for the code, we use the latest code status report and then the UNICEF internal data, which is basically NutriDash, and the latest maternity protection report. Basically, we use the latest one, which was 2022 ILO Care at Work report data. Next slide, please. We also gather data on counseling, which we basically generate from NutriDash, as well as the latest breastfeeding rates from the infant and young child feeding database of UNICEF. And we are also utilizing information from the most recent WBTi report by IBFAN and BPNI. And it is clear how essential the WBTi reports are for our annual scorecard. Next slide, please. So here, just to give you a quick snapshot, I know most of you know about this, but we annually monitor exclusive breastfeeding rates, which currently stand at 48% for infants under 6 months. The good news is this represents an increase of more than 10 percentage points since 2012. And we also track progress on other indicators, and recent data from 2017 to date shows that we are not quite where we want to be on some of these indicators, with only 46% of newborns that are breastfed within the first hour of life falling short of a 70% target, while 72% of women breastfed for at least 1 year, which dropped to 46% by 2 years of age. Next slide. This is progress that we celebrate. We see that it's happening at scale, it's happening across regions and countries. This is basically what the slide is showing. Out of the 106 countries that have updated their exclusive breastfeeding data since 2017, when the Global Breastfeeding Scorecard was introduced, we have seen that to date, 75 of these countries reported increases in breastfeeding rates, including 23 with increases of over 10 percentage points. This is really incredible. I mean, wonderful achievement to celebrate. But however, we've also seen that 29 countries face declines, with 6 showing decreases exceeding 10 percentage points. This shows we still have a long way to go and more action is required to push the breastfeeding rate forward and closing the equity gaps. Next slide, please. So here, basically, I'm just going to talk quickly about the programming and policy results. Then we go next. So I will look at donor funding. As we can see here, based on the updated data, it shows only little improvement, not much funding, especially like Larry said, we don't have enough information about funding from national governments, but based on donor funding, it's still little compared to what we want to achieve. Then, of course, on code legislation, progress has been made in countries with new legislation that is substantially aligned with the code. However, a few countries have effective mechanisms for monitoring compliance. Basically, only 17% of countries have laws that are substantially aligned with the code. And the same with maternity leave, as well as facilities to support women to breastfeed. Most countries do not ensure the availability of breastfeeding facilities or paid breaks for working mothers. There's still a lot to be done in these areas. Next slide, please. So for this slide, we've seen that also few countries include training on infant and young child feeding in their pre-service curriculum. And of course, for infant and young child feeding in emergencies, we've also seen that IYCF support is not routinely incorporated into emergency planning. But going back to what we're talking about today, WBTi, we've seen that only 6% of countries have conducted World Breastfeeding Trends Initiative assessment in the last 5 years, which means there's still a lot more that we could do to improve this. Next, please. So before I thank you all and leave, I want to say that really accelerated progress and commitment are essential to further improve our breastfeeding rates, as well as enhance its policies, programs, and funding. We really encourage countries to use the scorecard to track their progress on these indicators, thereby facilitating informed decision-making and actions. Thank you all very much. Back to you, Trina.
Thank you. Thank you so much, Larry and Fatmata, for those informative presentations on the importance of monitoring and on the actual scorecard that does the monitoring. So we have a Menti. Our next activity will be a Menti. We would like to hear from all of you, our audience, with an interactive question, which, can you see the question on the screen? If you go to this Menti, you should be able to see the question if you use that. Here we go. Here's the question. Which of the following is not, repeat, not part of the WBTi assessment? That is, one, a funding for breastfeeding policy and programs, human milk banking, International Code of Marketing of Breast Milk Substitutes, family level survey of practices, maternity protection, infant foods and trade agreements. The question is, which of the following is not part of the WBTi assessment? All right. We're seeing some results here. We're seeing folks have chosen the human milk bank as not, and family level practices, I think that is as not, and which one is this? Infant food and trade agreements as not. I think you were paying attention, everybody. We have a brilliant group of people with us. Any more thoughts? Great job, great job. All right, now we'll move to, now that you've heard the theory, we're now going to hear more of the actual how to. What is the WBTi processes and methodology? I would like to introduce to you Dr. Arun Gupta, who will be speaking to us about the WBTi processes and methodology. Dr. Gupta is an accomplished public health advocate. He is a pediatrician known for championing breastfeeding, child nutrition, and responsible food policies. He founded the Breastfeeding Promotion Network of India in 1991, and he is the chief coordinator of that network, as well as the coordinator of the WBTi Global Secretariat. Dr. Gupta conceptualized and created IBFAN's World Breastfeeding Trends Initiative, and it has been now operational in over 100 countries. In 2001, Dr. Gupta was named a fellow of the Indian Academy of Pediatrics. From 2010 to 15, he was a member of the Prime Minister's Council on India's Nutrition Challenges. And we welcome Dr. Gupta to tell us more about the WBTi processes and methodology. Thank you, Arun.
Thank you very much, Altrina, and thank you, UNICEF and WHO for organizing this very important webinar, very timely. I'll talk to you today about how it works and how we have to do it. So next slide, please. So this is how it has started gaining momentum, is that the WBTi Secretariat hosted by BPNI, which is part of the International Baby Food Action Network. And we have been in discussion with the UNICEF and WHO during the last year. How do we actually increase the mobilization and involve more countries to do assessment or reassessment to continue to participate and provide data for the Global Breastfeeding Scorecard, which Fatmata and Larry had mentioned just some time back. So we entered into a partnership this January, and it will continue for about 3 years, and where we intend to strengthen the WBTi work globally, and we hope that 30 to 50 countries are reached out, and we have already seen interest from so many more countries from all parts of the world. So this is how this program is being now led by BPNI, which is the Global Secretariat. Next slide, please. So what is it? So as Larry has already mentioned about it briefly, I'll tell you about this is a reliable tool which has been tested by using in several countries, and some independent researchers have also evaluated it. And the tool has several processes which I'll talk to you a little later. This measures the country's 10 policies and programs, which many of them are the 7 asks of the Global Breastfeeding Collective's report card. So the point here is that it's not just for measuring once, it actually generates action at the country level to bridge the gaps. How it does, I'll come to you later, and continue to monitor it repetitively so that we know that we are making progress, and where we have still left, we can still continue for a change. So that's how it acts as a catalyst. So it's not something that external implementers are just not thrown from the top. It's that the local people get involved, local people constitute the core groups, local people assess and analyze the situation and act. So it's like the AAA approach, which happens very locally at the country level. It's a very participatory process which is used in here to build a consensus among the core group people how to actually reach a particular area of a gap and recommend it for change to the government. It's simple action research. So the WBTi does not ask for doing new surveys. The WBTi work is actually simple, based on the secondary data available in the country, documented, publicly available, or available through the government sources. Next slide, please. So there are 4 components. So first is the component where the WBTi is rooted at the national level and conducts an assessment of these 10 policies and programs. So that's how how it is done. I'll talk in the next slide. Then go back, please. Yeah. From here, the process for generating country reports and gaps. So when the national core group actually conducts assessment, it results in a country report and a report card, which is a ready reckoner of the same report, very easily understandable in short period of time. Then these findings are uploaded into a web-based repository, which is the software tool developed by BPNI, and it gets into a scoring system, which is objective scoring and color coding, and the data bank also ranks the countries dynamically. Whichever country joins and gets a score, there is a dynamic score ranking system that we know. Today we know that if you go to the WBTi website, you will find the 100 countries, you can see their rank according to their policy scores. So the fourth component is, it is a built-in process to use the findings for advocacy. So it just doesn't rest there. So it's just not assessment and just rest the assessment report in your rooms. It is actually built-in process that the country groups take it to the government, take it to the other partners, take these findings to where they matter, so that the country can start building some changes based on those findings, making it as a kind of evidence generated locally, and then action is generated out of it. Next slide, please. This is an example of a 2015 report card from India. You see how the color coding is done on the 10 indicators, which is like national policy and funding, baby-friendly hospital initiative, code implementation gets green color, and the first 2 were red at that time. Maternity protection, health and nutrition care system, mother support and community outreach, information support, infant feeding and HIV, and infant feeding during emergencies, mechanism of monitoring and evaluation, this particular program. So this is the tool so this is a graph generated from the WBTi web portal. Every country who has a report can generate such graphs, so it can be presented to the policymakers. Next slide, please. Yes. So when we do the assessment at the country level, we have to keep in mind these clear-cut objectives, why we are doing it. So this is to evaluate national policy and program, at the same time collect data on the practices based on the national surveys. Identify areas that need improvement, discuss them among the core group, and then provide this important information to the governments. So when the governments get this information, they also ponder over it, and then whatever changes are required. They can prioritize it based on which color to change first, and then they can go bring the change, and then we move into the next phase. So then this is the program which also creates a unique global repository of policy and programs. Now, of all the 100 countries who have done these assessments and reassessments in the past 15 years, you can find they are freely accessible on the web portal by each country, and you can download the reports. You can see what policies and programs are being implemented in that country, which can give examples to other countries what can really be done. Yeah, next slide, please. Now, these are the tools which are available. Which the first one is on your right is these are the tools which are the questionnaires, which are available in English, French, Arab, and Russian. And then we have a guidebook which simply tells you in a half an hour reading what the whole process which I'm talking today. And we have a promotional brochure also available. All these tools are available on the website. You can download them and you can make use. Next slide, please. So I will skip this slide, which I've already read the indicators. These are the 10 indicators which we assess. Next slide, please. Now, these are the 5 indicators of the practices which we collect from the national data system, and they are not they're based on WHO's. So this whole questionnaire is based on WHO's tools for assessment, which were launched in 2003, and these 5 indicators are part of it. So to keep the uniformity, the same tools are used all over the world. So the tools are translated into the different languages for diverse use, but they are available, and the questionnaire is the same and the uniformity is kept. So comparison can be easy. Next slide, please. Now, this is a slide I'll spend a minute on, is that if you look at this top block of this graph first, you will see that the step 1 in this WBTi process is to identify the country coordinator. Many of you present in the room today might have experienced it, or you want to be part of it. And a person must be available who is a country coordinator, who is in direct touch with the WBTi Global Secretariat for any assistance, as well as on sharing, so that we can coordinate this perfectly. The country coordinator has a role to actually constitute a core group of maybe 5 or more people who are belonging to the UN agencies, professional bodies, any other non-government organizations, or the governments who are interested to be part of the core group to do assessment, but without any conflict of interest. So core group constitution guideline says that there should be no conflict of interest within the core group. The core group actually does the first part of the assessment. Of the 10 indicators, they divide the work among themselves, and they share those findings among themselves, and then they discuss and develop a consensus of gaps and recommendations. And that's where the whole thing actually rests, that it is not just one person sitting in the room. It's a part of a group which is doing, and that the group can decide the changes and decides the recommendations. Then this report goes to a larger group in the country, presented before it is finalized, and seek their feedbacks. And those feedbacks are incorporated, and if there is a change required, it is done based on the available resources, because the findings of the report are based on an information source. It is not based on an opinion. So that's an important part of this report, that it is based on the sources of information. These links are provided in the report as a source. So this group decides, and after that, once we know the final gaps, and draft report is shared with the WBTi Global Secretariat, and there is a process and checklist of verification of all the information provided in the report, and checking the national data. If it is not just an ordinary study, but a national data is presented. Then this report goes to government and public, and then expected to bring policy and program changes. And that is how we recommend a repetition after 3 to 5 years, that once you know the progress, that can help you bring next level. Next please. So what happens is that we provide 6 hours online training course for the people who are going to do it. So we continue to provide online technical support from the Secretariat. You require about $5,000 minimum, but some countries need more money depending upon your local calculations for communications and meetings. Opportunity for fundraising is created locally, and the total duration it might take from 6 to 12 months. There are 3 to 4 core group meetings and 1 large group meetings. Next slide, please. Yeah, these are few country reports to share with you. These are recent from Italy, Croatia, UK, and Netherlands. More and more developed countries are now joining the WBTi. Next slide, please. These templates to create reports are also available on the website. So next slide, please. Now we talk about a couple of slides on the what kind of impact. So we actually did this evaluation within the WBTi when there were 80 countries and 51 countries participated. And we found that those countries, there was a relationship who repeated the WBTi assessments. We found improved policy and programs as well as the practices. The scores were higher. Next slide, please. So these are individual country examples like Afghanistan improved in funding, legal framework, infant feeding and emergencies. Bhutan again improved in the BFHI and women at work as well as funding. And then Dominican Republic showed improvement in BFHI, IFE as well as workplace policy. El Salvador, you will hear more, and they also improved funding and BFHI as well as legal framework. Next slide, please. This is my last slide, and see how the changes look like. I'll show you a couple of examples from India. For example, the Maternity Benefit Act, which provided 12 weeks of maternity leave since 61, has now been amended to provide 26 weeks of maternity leave, as well as included many other sectors like shops and establishment, mines, etc. within this framework. And another big thing which has happened is the National Disaster Management Plan. The policy earlier included commercial baby foods, has now been replaced with breastfeeding counseling. So that's all from me. And if there are any questions, please write in the Q&A. Thanks a lot.
Thank you, Dr. Arun. That was a great presentation on the how and the what. So now that we've learned about the why, the what, and the how of WBTi, next we have a 3-person panel of experts from El Salvador, the Gambia, and Croatia, who will share their experiences with conducting and applying the WBTi in each of their country contexts. Ana Josefa Blanco Noyola is the executive director of Calma de Apoyo de Lactancia Materna in El Salvador. She will share El Salvador's country experience in using WBTi to strengthen breastfeeding policies and programs. We have Mr. Bakari Jallo. He is the deputy executive director of the National Nutrition Agency in the Gambia, and he will give us their perspectives and experiences. And thirdly, we have Dr. Irina Zakarija Grikovic, and she is the WBTi Regional Coordinator for Europe and a prominent breastfeeding advocate based in Croatia. She brings regional insights and technical expertise to support effective WBTi implementation across the European countries. So I will be asking each of them a question based on their individual country experiences. El Salvador, having conducted 3 rounds of the WBTi, Ms. Ana Josefa Blanco, can you share some key lessons learned in the process and a couple of challenges you met along the way in the conduct of the WBTi?
Muchas gracias, ¿verdad? Un saludo a cada uno de ustedes en esta gran oportunidad. Realmente en El Salvador, que hizo 3 informes del 2011 al 2018, nosotros nos encontrábamos con varios desafíos. Uno era la baja tasa de lactancia materna exclusiva y el inicio temprano de la lactancia materna. Otro tema bien fundamental para nosotros era que la licencia de maternidad era de 84 días. No teníamos también un plan intersectorial de lactancia materna, no teníamos una ley de lactancia materna. En El Salvador se habían hecho muchos esfuerzos durante 25 años para tener una ley de lactancia materna, no la teníamos y no teníamos una comisión de lactancia materna y un decidido respaldo político, ¿verdad? De alguna manera, ante este escenario, nosotros vimos importante la implementación de la estrategia de tendencias de lactancia materna, el apoyo de IFAN a nivel latinoamericano y el apoyo que encontramos en UNICEF. Y nosotros consideramos que ha sido importante en este proceso de que exista, dijéramos, el apoyo de esa institucionalidad, ¿verdad? Que exista también, como fue en el caso de nuestro país, una comisión de lactancia materna, un comité técnico de lactancia materna. Este comité, dijéramos, esta comisión de lactancia materna era una comisión estratégica, ¿verdad? Con representatividad de todos los sectores, incluyendo de los gremios también médicos de pediatría y de ginecobstetricia. También la otra cuestión era en la parte nuestra que una organización no gubernamental asumió prácticamente, ¿verdad?, la responsabilidad de mover este tema a nivel nacional y encontramos el apoyo del Ministerio de Salud, de UNICEF, muy abiertamente, y también el apoyo también de muchas instituciones públicas y privadas y comunitarias que venían trabajando en el tema. Además de eso, también lo que esta institución hizo, lo que nuestra institución hizo es de que también que cada vez que llegaba un ministro, cada cambio de gobierno se presentaba una propuesta de mejora de la lactancia materna. Los informes del WBTi nos permitieron en las 3 ocasiones que se hicieron en el país identificar brechas, ¿verdad?, a las cuales les dimos seguimiento para que estos se convirtieran en cambios de política pública. Quiero mencionar también de que aquí hubo una confianza de un gobierno en trabajar con la sociedad civil. Y creo que es importante. La sociedad civil en nuestros países conoce la problemática de la lactancia materna, está involucrada y es bien importante y está también libre de conflicto de interés. También, dijéramos, en esta parte, ¿verdad? Fue bien fundamental que esos 3 informes que se hicieron, hubieron participación de todos los sectores, gobierno, sociedad civil, cooperación, y quiero destacar aquí algo bien importante, es los roles que deben de tener, por ejemplo, el Ministerio de Trabajo. El Ministerio de Trabajo tiene un rol fundamental también en darnos la información, ¿verdad? Todos abrieron su información, porque una de la debilidad que encontramos también es de que había mucha información, ¿verdad? Pero no toda estaba sistematizada. Eso se fue mejorando poco a poco.
Thank you so much, Ana Josefa. That was very informative. And let's move on to the Gambia. Ana Josefa touched on the use of a multi-sectoral teams, and I think Gambia has had quite an experience there, where they have conducted 2 rounds of the WBTi. So, Mr. Jallo, please share with us Gambia's experience working with multi-sectoral teams on WBTi and the impact of their roles.
Thank you very much, Altrina, and thank you for giving us, the Gambia, the opportunity to share our experience in WBTi. Sorry, there is echoing from
There's
the
a little
Spanish
glitch here.
translation.
Help
Okay.
us, folks, with the translation. The translation is coming through, I think, in Russian. Okay, continue, Mr. Jallo.
Okay. Yes. So our experience with the multi-sectoral team started in the early stages around the later part of the 90s, when the first national nutrition policy was being developed. And considering that nutrition is multi-sectoral, prior to 2000, there was a nutrition unit under the Ministry of Health. And soon, understanding when the policy was being developed, it was decided that the policy should, a nutrition agency should be established and be placed under the Office of the Vice President instead of under a sectoral ministry. And at that time, a ministerial council was also established to coordinate all nutrition issues at the Office of the Vice President. So with that at the back of our minds, when we were doing the first WBTi in 2008, we established a multi-sectoral team. And since then, we have always been using a multi-sectoral approach to implementing all nutrition programs, assessments, whatever we are doing with regards to nutrition, we bring on board the multi-sectoral team. And this has helped because in the early 2000s, our exclusive breastfeeding rate was very close to less than around 10%. This has now grown up to over the years from then to now to 56%. And recent national studies, which are part of our process studies, have even shown that the exclusive breastfeeding rate has now gone beyond 60%. So this is showing that we have been working with multi-sectoral teams. Because of their involvement in implementing nutrition programs, we are able to have this impact in raising awareness and also increasing the adoption of the practice of exclusive breastfeeding amongst mothers in the Gambia. Thank you.
Maybe you can elaborate a little bit on which groups, who was in that multi-sectoral team, who was represented there?
Okay, right. The team, like I said, it's multi-sectoral. We have people from the government sectors. This includes the Ministry of Health, Ministry of Agriculture, Education, Community Development, Ministry of Finance, and so forth. But we also have people from the NGO and the civil society organizations, NGOs that are either doing work related to nutrition directly or those whose work affects nutrition. Also, we have our bilateral donors who support nutrition, and they also are represented in the multi-sectoral team. And we have other development partners from the UN system, that is the UNICEF, WHO, FAO, WFP, UNAIDS. These are all institutions and organizations that we bring on board as members of the multi-sectoral team. Of course, we have not forgotten the research and the academia. We have the Medical Research Council of UK. We have the Agricultural Research Institute and the institutions of higher education in the Gambia, which are also part of the multi-sectoral team. Thank you.
Excellent. Thank you so much. Now, at least we all know who you need to include if you're going to undertake a WBTi assessment and how important it is to include them. Let's move on to Croatia, which has also conducted 2 rounds of the WBTi and was able to develop an emergency IYCF policy as a result. Dr. Arina Zakarija-Grikovic, please describe the role of WBTi in bringing about this IYCF in emergency policy.
Thanks, Altrina, for your question. The WBTi actually played a decisive role in developing guidance on infant and young child feeding in emergencies. Back in 2015, when we conducted our first WBTi assessment, following the first training workshop for European coordinators held in Geneva of the same year, we realized that infant and young child feeding in emergencies was the most poorly rated of the breastfeeding policy and program indicators, scoring only 1 out of a total of 10 points. These findings, as well as the findings of our report, were presented at the Ministry of Health in Croatia to various organizations who play a role or have an interest in infant and young child feeding. As a result, in the second National Program for the Protection and Promotion of Breastfeeding, which was published in 2018, one of the goals listed was the production of guidance on infant and young child feeding in emergencies. So soon after, a working group comprising of members of the National Breastfeeding Committee was formed, and based on the operational guidance for infant feeding in emergencies, we adopted the operational guidance to our setting, and in 2023 published the first national guidance on infant and young child feeding in emergencies, which, if I remember correctly, thanks to the WBTi, placed Croatia, I think it was second in Europe and third in the world at the time, following New Zealand and North Macedonia, as countries who have their own national guidance on infant and young child feeding in emergencies. And that's not all. Thank you. In the meantime, we've published our third National Program for the Protection and Promotion of Breastfeeding last year in 2024, and one of the goals is now to produce an action plan for the implementation of the guidance. So our aim now is to produce training materials for emergency management and relevant healthcare personnel, as well as to conduct training of all those involved in emergency responses.
Thank you very much, and congratulations on that. Now the world seems to have so many emergencies. It's really key and important that we have these policies to be able to react, to respond quickly, and to promote and protect breastfeeding during these challenging times. Thank you. I'd like to go back to El Salvador. Ms. Ana Josefa, please describe the role of WBTi that led to policies that extended maternity leave and established milk banks in support of breastfeeding in El Salvador. We can all learn from that.
Bueno, realmente ha sido fue un trabajo en ese periodo del 2012, perdón, al 2018 muy arduo, ¿verdad? He mencionado yo de las ventajas que tuvo nuestro país, y lo digo con bastante humildad, ha sido trabajar con una organización de una trayectoria que actualmente tiene 45 años, que es la entidad donde yo trabajo, y que se había venido involucrando realmente en toda esta temática. De alguna manera, el WBTi era una oportunidad para mejorar los indicadores. Realmente era una oportunidad, ¿verdad? El informe de tendencias era una oportunidad realmente para solventar todas aquellas brechas que en nuestro país teníamos. En nuestro caso, por ejemplo, la evolución de la lactancia materna exclusiva no era muy sostenida. También lo que es el apego precoz y el inicio temprano en la lactancia materna estaba con tasas bastante débiles, y otros indicadores de lactancia materna que también nos llevaban a analizar que realmente teníamos que buscar otras medidas de política que realmente apoyaran a esa mujer lactante. Y en ese sentido, mencionar de que uno de los aspectos bien fundamentales que se vio para este cambio de la licencia de maternidad fueron los resultados del WBTi, porque aparecía en una de las brechas, ¿verdad? Entonces, para eso se tuvo que hacer un plan de trabajo, que fue parte de un comité intersectorial, y este fue apoyado también por las autoridades del Ministerio de Salud y también los legisladores del Congreso de la República de El Salvador y la participación intersectorial. Esto nos conllevó también a otro tipo de logros, por ejemplo, en el marco legal, pues tener una política que era apoyada por todos los sectores y no solamente por el Ministerio de Salud. El Ministerio de Trabajo, por ejemplo, que lo mencioné anteriormente, es fundamental en este cambio de políticas porque también en nuestro país se estableció los centros amigos de la lactancia materna y las salas de la lactancia materna, ¿verdad? Con la hora de permiso, con goce de sueldo que tenía la mujer lactante trabajadora. También conllevó a que se aumentara la licencia de maternidad de 84 a 112 días. Eso fue bien fundamental. Pero también veíamos de que habían otras medidas que había que tomar, de que en nuestro país a veces las mujeres en el embarazo y al regresar de su licencia de maternidad eran despedidas. También aquí hubo un apoyo también de los legisladores para establecer que ninguna mujer podía ser despedida en su etapa de lactancia ni a su regreso de la licencia de maternidad, ¿verdad? Eso le dio una protección bastante fuerte a la mujer lactante trabajadora. El plan estratégico también que se implementó, que tenía una enorme participación, ¿verdad? Y apoyo del Ministerio de Salud, porque en los indicadores también se encontraron áreas débiles, tanto en la parte de políticas como en la parte de programas, y hubo un trabajo exhaustivo desde el despacho del Ministerio de Salud para superar, por ejemplo, aquella brecha de la lactancia materna en
Thank
emergencias.
you.
Es un tema sumamente importante. En ese sentido, creo yo de que algo
Thank
también...
you so much.
Thank you. Gracias.
Thank you so much. I think that, as Larry mentioned, that you find high-income countries have not made as much progress as many other countries around the world. And you could teach my country and my state of Maryland of how to improve and increase the maternity leave. We've done WBTi, and we still have a long way to go in providing adequate support to breastfeeding moms and moms who recently delivered. Let's move on to the Gambia. Mr. Jallo, please inform us about the challenges faced with accessing data. We hear it's so important to be able to access data that's available in the public for use in the WBTi assessment. So maybe you could describe some of the experiences you had and how you overcame some of those challenges in accessing data for the WBTi assessment.
Okay, thank you very much. If you know the Gambia, you will know it's one of the least developed countries. So in terms of economy, it's we are lagging behind a lot. Because of this, we don't have a lot of surveys or researches that are carried out to collecting data related to infant nutrition and health, maternal nutrition and health. So one of our problems is paucity of data, especially in the area of IYCF. We have tried to post this, and now we have, prior to 2008, we were only doing MIX, that is the multiple indicator cluster survey that was collecting data on IYCF. But recently we have also started doing the DHS, and now we interchange them between the interval of data collection is short. Because of that, also the data that is available is usually very old. It's aged because we were relying on only the mixed data. which was the nationally representative survey. All the other data that we had were either regionally based or were cannot be nationally representative, so we cannot use it. And sometimes the age or the time when the survey was collected was done to the time when we are doing the WBTi, there is a long time gap in terms of time period. So a lot of changes could have happened and we could not get updated information. So basically, there are two problems with regards to our data. It is the paucity of data in those days, including the fact that the data is aged. That means it's been collected for a long time before the WBTi assessments. Thank you.
Thank you. And I think other countries can learn from you that even if you don't have all the data and it's not all up to date, you can find ways to still be able to conduct the WBTi. Don't be discouraged. So we've recently had a new member join us, Dr. S.K. Roy. I am so happy you were able to take the time to come and join us. We know that you're not feeling too well, so we'll give you a few minutes to be able to share what's happened in Bangladesh. Dr. S.K. Roy is the chairperson of the Bangladesh Breastfeeding Foundation. He is a pioneer in public health nutrition in Bangladesh and has led multiple national WBTi assessments and policy dialogues to advance breastfeeding promotion and support. Yes, Bangladesh has had the most experience with WBTi. It has an impressive 5 rounds of the WBTi. My question to you, Dr. Roy, and welcome, is Bangladesh has successfully mobilized funding for breastfeeding and IYCF interventions as a result of its experiences with WBTi. Please describe the process that WBTi the process from WBTi to these key outcomes of increasing funding and also implementing, leading to IYCF interventions. Thank you very much.
Thank you, madam. Can you hear me?
Yes, we hear you very clearly. Now
Yes.
can we see you?
It's
There
a
you
great,
go.
great
Welcome.
pleasure that I have been able to join you. This is a great occasion. I was very sick, but just coming now. This country has really been very fortunate to have several rounds of WBTi conduction and training among the staff. This has followed the program and got a lot of help, a lot of support from the WBTi Secretariat New Delhi, IPAN. We have actually involved the government from the beginning, and government have been very, very impressed to see the activity that is going on in the country, in the leadership, with the leadership of the BBF. And so the government has now allocated the fund for conducting the WBTi. So this is not a problem now. For us, we have completed the
Excuse me.
number 6.
Excuse me,
Last,
Dr. Roy, your camera is off. We can't see you.
you cannot see me? Yeah.
No.
Yeah,
There
okay.
you go. All right, thank you. Continue, please.
Thank you. So the government has actually given the fund. They give us fund for the whole year. And we make all the programs throughout that fund. So only on the 30th of June, we completed the 6th round of the WBTi, and we will, in July, I think we will be able to give you the result. So this is very interesting to mention that the Ministry of Health people, they are much more interested, and the NGOs, they are very interested to come to our meeting of the WBTi, whatever, full of people, 100 organizations, they came this time, 100 organizations, they participated, including academia and the NGOs, UN agencies, etc. So actually they took a lot of interest in discussion and recommendation, further improvement, how we can do it. And you might know that in 2020, Bangladesh scored the first position in the global WBTi assessment. So after that, we are having the second now, the assessment. The situation here is that the exclusive breastfeeding has a little bit reduced than earlier, that we are noticing. The bottle feeding that has reduced. All the indicators have improved. And our training of emergency situation, this is also very commendable, that, you know, we had the evacuees from the Myanmar, lots of 2 million, things like that. So we have saved those children from the breast milk substitute. We could give them the breastfeeding and train the mothers. So these are some successful stories.
Excellent, thank you. It's really impressive that you are able to mobilize government with the WBTi results and get them to put their money where their mouth and hearts are to fund these activities. That is a great experience that I hope we all can learn from. It's so good to have you with us, Dr. Roy. So back to Croatia. Dr. Arena, can you describe the process Croatia used in validating the findings? Now, we're hearing about in different countries, they had 100 partners, in other countries, they had 40, 50 partners. How did you go about validating the findings from the WBTi, assessment and getting buy-in from all these various different partners?
Thanks for the question, Altrina. Well, I think one of the goals of the WBTi is to find and report reliable data. That's key in order for governments to be able to recognize which areas should be targeted as far as investments of resources are concerned, and also in order to be able to compare the findings between countries. And there are several things that help ensure that reliability of the information collected. One important point is that the members of the core group must be free of conflict of interest when it comes to the infant and young child feeding industry. Another important point is that national data should be used when conducting the assessments, if at all possible. Of course, when we did our first report, there was some confusion over the interpretation of some of the indicators, but that's where Dr. Aaron and Dr. Nupur came to the rescue and generously offered their expertise in interpreting the indicators and just clarifying things that we weren't sure how to interpret. We also decided to form a European group. So we meet on a regular basis via Zoom and have a mailing list where we share our experiences and discuss queries in regard to assessment, because we all aim to apply the same standards in order to make the reports comparable. We also decided to record our queries in a Google Doc to which Arun and Nupur would enter their comments, and this was available to the European coordinators, given that we were all at different phases of our assessment, as a tool for those who may have similar queries down the track at some stage. As you mentioned, a very important part of producing the report is obtaining feedback from partner organizations, that is, organizations that have a role and interest in infant and young child feeding in our setting. And obviously, being a national coordinator of a global initiative helps. That gives you a certain authority to which people are more likely to respond if you reach out to them and ask them for their opinion, and if you ask them to provide feedback. So that definitely helps. So being a national coordinator and having the WBTi behind you helped involve national organizations, both professional and public, in the process. So their feedback was very important. We considered the feedback very seriously, incorporated it where we thought it was appropriate, and then provided a final report which we sent to the WBTi Secretariat, where they do a final validation procedure, a very detailed one, checking our sources, checking to make sure the report is consistent. So Nupur and her team, of course with the Aran's support, do a very detailed check of the final report before it actually goes public. So all of this really contributes towards producing a trustworthy report which people can take as being reliable and up to date.
Thank you so much, Dr. Arena. It's very interesting hearing from the countries. I think all of the participants, along with me, now have a good feel for how countries have used the WBTi for policy implementation, for getting buy-in and for getting support for breastfeeding. And it has come with results that we heard about how exclusive breastfeeding rates have increased. We've heard about how maternity leave has been increased and so on. So I would encourage all of you that are online that if you're interested or thinking about it, to move forward with conducting the WBTi. It would really help with your country with advocacy for supporting and improving breastfeeding.
Trina,
So
if I
now,
may just
yes,
add one point, which I
please.
forgot to mention before, something specific to the Croatian team, and that is when we did our second assessment, we realized that in order to make our findings even more objective and valid, we decided to allocate 2 people to each indicator, and those 2 people actually assess the indicator independently, and then compared their findings, and if there were any differences, of course, discussed their findings in order to come to a mutual agreement. And if that wasn't possible, a third member of the team was included. So this time, in order to make our assessment even more rigorous, we felt that even though in the first assessment we would report our findings to the rest of the team and discuss it, we thought that if 2 people do an in-depth assessment of each indicator, that would provide an even more robust report.
Thank you. That's an important point there, because we know these indicators can be interpreted so many different ways, and we've had challenges with that. So if you all heard Dr. Arena say that it's important to have 2 people to look at each of the indicators to make sure that they come with consensus on the definition and the findings, et cetera. That is really important to validating your findings. Thank you, Dr. Arena. All right, so let's move on. We're going to do another Mentimeter. I think we're going to do another Mentimeter. Yes. So the next Mentimeter, the question will show up any second now. If you go into it, is on following these excellent presentations. You can now say, how would you use WBTi to improve overall protection and support of breastfeeding in your country? This is open-ended. You can write in your thoughts on that, and we look forward to hearing from you and learning more about which countries, and please state the country too, how you would use this, the WBTi. No, you must have very deep thoughts. You're writing, busy writing, they're not showing up just yet. Here we go. Mothers, someone said. I think that just got the end of their thought. Any other thoughts? Galvanize action and investment in national policy and planning. Yes, for IYCFE, especially emergencies. We're finding more and more emergencies as climate change and other things are coming on board. Use the results to get, to get funding, yes, for improving breastfeeding education for health and professionals and support and counseling for mothers. Yes, so many ways we can get governments on board to release those funds and to put those funds into programs. Oh no, I lost everything. Sorry. I am on my phone and I lost the Mentimeter. No. Help. This happens, doesn't it?
No worries, Altrina. Why don't I do a little bit of reading for
Yes.
you and you can
Thank
process
you.
here. Absolutely. So we've got some really lovely responses here. Folks talking about mobilizing government and health facilities to promote and support breastfeeding more, working on policy improvement, planning, management, and funding, data collection and monitoring. Hungary added, a representative from Hungary added to make the government aware that they have work to do in this area, right? That's such an incredibly important part of the process. Someone saying they would use it as a tool for advocating for the implementation of the operational guidance on IFE. Let's see, what else do we have here? Someone saying it would be great to have Canadian data included in WBTi, along with other high-income countries. Finding a way to influence ministries of health is influential as well. Let's see if there's a couple other I will highlight, and then I'll pass this back to you, Altrina. Someone, Japan, saying, I would really like to see Japan added to the WBTi and also the Global Breastfeeding Scorecard. Definitely a lot more extensive and effective IWAY-CFE training and implementation. And then someone from the UK said they would like to be feeding the reports to their legislative branch, to the MPs, that yesterday in the UK there was a debate in the House of Commons.
Excellent, excellent. So it looks like there's plenty of use for WBTi moving forward, and that we can expect that hopefully that you'll be able to implement that and get on board, and we can see what's going on in the world and how we can really advocate with our governments to invest in breastfeeding and improve infant and young child feeding globally. So I want to thank all of you and all of the contributors and supporters to this webinar. As you can see, I think in the next slide, unfortunately, I can't see any slides, but there should be a list of the various contributors to this webinar through the Global Collective and through WHO and UNICEF. And then our next slide is on the call to action. And could you assist me with reading that since I can't see it?
Absolutely. So there's two things here. The first is to use the QR code that is here on the slide. This will take you to a form where you can express interest in and learn more about WBTi. So, that's the QR code on the screen. And also, Jorgen, thank you for posting that in the chat as well. And then additionally, we encourage you to access the Global Breastfeeding Scorecard. It's a great opportunity to learn more about how your country is doing. All of these links have been made available in the chat, but in case that you missed them or haven't been able to grab them, they will also be sent to all registered participants, and all of this information is also available if you just visit the Global Breastfeeding Collective website.
Great. So since we still have a couple of minutes, did you want to go through some of the questions that participants raised?
Oh, great idea. Nina, would you like to hop on with some of the questions?
Hi, it's lovely to be with you all this evening, and don't we have a panel of luminaries and very experienced folks with us? Altrina, I think the question that is coming up fairly regularly on the Q&A panel is, on the question panel is, would some of the panelists like to share with us a little bit about how WBTi, the very first part of WBTi, has been initiated in their countries where it hasn't been initiated by government. So how have they gone about that? I think probably Irina might have some contribution to make there, and I'm not sure. And then perhaps one or two of the other panels from government might talk to us about what governments find valuable about it.
Mm-hmm.
Great, thank you. Irina.
Yes, thanks, Nina. Well, it was actually IBFAN, the International Baby Food Action Network, whose mailing list I'm on, that invited people to apply for the first WBTi training workshop that was conducted in Geneva in 2015. So luckily I saw this invitation forwarded to the National Breastfeeding Committee, of which I'm a member, and suggested that we get involved and ask for their approval to attend the event. So that's how we found out about the WBTi, thanks to IBFAN and their network.
Great.
May I add to it that IBFAN has conducted these trainings all over the world since 2008 and 9. We went out to every region of the world where we trained people to act as country coordinators. So majority of them were IBFANers, but from other sources also people were involved. After that, lack of resources have not allowed us to do physical, but we have started doing online trainings now. And so that system is also working. So currently, many countries have shown interest in WBTi assessment and reassessments. So we are hoping that in the we already have finished training for a couple of regions, and in the coming months, we hope that other regions will be training too. Spanish region is already training Spanish speaking people because we have trainers there from IBFAN, they are doing it. So similarly, though, wherever there is interest, Global Secretariat sometimes have to also be involved one-on-one support. That's what technical support is provided to countries who are interested in receiving this information and answer those questions, how to go about in practical sense. Over.
Thank you. Thank you. It looks like the IBFAN is the people to contact to really help if you want to do it from the NGO perspective. Are there any more questions or one quick question?
Yeah, although I think our colleague from El Salvador may have wanted to contribute to that question.
Yes. All right, please, Ana Josefa, please.
Sí, acompañar lo que los colegas han mencionado, el papel de IFAN en el caso de nuestro a nivel Latinoamérica fue fundamental. De ello recibimos nosotros la formación. Eso nos estimuló mucho realmente para empezar a hacer una gestión a nivel nacional, iniciando también con la formación de nuestros propios recursos, los recursos que éramos miembros de IFAN y otros recursos de nuestra institución. También otros pasos que nosotros dimos fue también hacer un pacto por la lactancia materna en 2 ocasiones para hacer un llamado general a todas las entidades públicas y privadas para que acompañaran toda esta iniciativa y la promoción y protección de la lactancia materna. Y aquí lo importante también es que nos acompañaron diferentes autoridades de diferentes ministerios y también diplomáticos, ¿verdad? Quiero hacer un reconocimiento a esa parte diplomática como Mimi Prado, ¿verdad? Que era diplomática, pero además ella era promotora de la lactancia materna. Entonces todo eso generó mucha motivación a nivel del Salvador. Muchas gracias.
Thank you
so much for sharing your experience too. All right, we have come to the end of the webinar. Thank you so much for all of you who have presented, Dr. Larry, Fatmata, our Arun, and start my video. I don't know what's happening here. Anyway, I hope you can still hear me. Arun, and also our panelists, Anna Josefa and Mr. Jallo and Dr. Arena and Dr. What's the last one? Roy. All of you have really made this a very interesting and informative webinar, and I hope you all have, those of us who participated, have learned as much as I have and have been energized to go and do something. I'm gonna see what we can do here in Maryland about that. But I hope in your own countries. And I thank all of you participants for signing up and joining in with us. So without any further ado, I leave you to carry on with the rest of your day. Thank you. Have a good evening, a good morning, or good afternoon.